Hello. Uh, Hi, this is Ellen Teeter. I'm the Executive Director of FSOMA, and welcome to FSOMA News number 14, where we're trying to let you know about news in FSOMA and around the state. Have President David Bibby with me here today, and we're going to go through a few things. If you have a question, we're going to just go ahead and use the chat box. It's the little bubble over the word chat. You click on it and you can type in your question. We're very glad you're here, and we'll get going. So I want to talk about a lot of upcoming events through FSOMA. The conference, of course, August 13th through 15th. You've got to register for this. We've got great speakers. We're live. It's going to be, it's just so good. I did a live webinar last week and it felt so good to be connecting with people again. July 12th, we have the Emerging Professionals Support Group. We're launching support for first and second year practitioners, for students just getting out of school. There's more coming in that line, but if you know anybody or you yourself just want to chime in and see what's needed to help you with your practice, with either jobs or building your own practice, or questions about working for someone else. Those seem to be the models we have going. We're going to be supporting people with that. There's an hour webinar, CEU, Introduction to 2021 Mandatory E&M Documentation Guideline Changes. So these are some changes if you're making notes and filing insurance you need to know. And even if you're not filing insurance, it would be good to know this information. We have a Building Better Business webinar July 19th, collaborating with physicians. That's was moved from a couple months ago when the lawyer from the Florida healthcare law firm got ill and couldn't do it. So we rescheduled it. Coming up on June 29th, coming up next week, recognize addiction symptoms in yourself and others. Board member Demita Hartz is also a psychologist and is our therapist, and is going to give us a presentation. A lot of times we have patients that some of their problems may be substance abuse. So another Building Better Business coming up July 5th is with Galena Rufner, Is Your Herbal Practice Safe? Know the clinical and legal standards. And then we have a Saturday, look on the website, it's July, I can't remember the exact date, but it's coming up in July, for Love Your Practice, with I think 12 different speakers talking about different aspects of your business and getting the word out about your business. So we have some great events coming up and hope we'll see you at those as well.
Is the Love Your Practice the one that we're doing with Laza?
Yeah, LASA OMS is sponsoring this.
Yeah,
and
it's July 10th.
They did it last year. Yeah. Well, there should be time at the end. I'll pull up we can look at it a little more in depth, because it does have a lot of great classes going in it.
I'm just kind of blown away. I'm looking at July. We've got something almost every week of July. All of it's exciting and impactful, things that people have been asking for and things that are really helpful in everyday practice. And it culminates with the August dates for the conference. It's a lot going on.
Yeah. And some great speakers. We're very fortunate to have Galena Rufner in Florida now. She was with the Cleveland Clinic in Ohio, and she lives in Florida now. And the Chase, do you remember his last name from the
Chase
law
Howard
group?
from
Howard, yeah, he's kind of the acupuncture specialist with the Florida healthcare law that is collaborating with us and offering free consultations. So yeah, some great classes coming. So all right. So just a reminder, we had Acupuncture Education Day on Zoom in the first quarter. And the second quarter, we showed you how to make video testimonials. I still don't have any of those posted except the one I did. But we need to build up a little library of those. So if you need some help with that, let me know. Let me just quiet myself for just a second. Sorry about that. I have a little puppy dog that was on the porch barking. So, trouble unmuting. So, all
Ellen,
right.
you're
So the third quarter is to visit legislators in the home district. And fourth quarter, we'll be doing an email campaign for 2022 legislation. So just to let you know, it's not necessarily easy to get an appointment this summer. Usually it is, or in the past, historically it was. My senator is not making appointments till September. They said to call back then. Representative Will Robinson is only doing Zoom, and I have to schedule that after July 4th. Natalia is working on it. I don't know what's happening with that. And then David is waiting to hear from Representative Masulo and Senator, you said Wilton Simpson is the president of the Senate, so he's busy. Yeah. So it's not always easy to get in there and see them, but it is important for us to make those visits, to see them, to be have a personal connection, so that if we have to go to them with our hat in our hand for something, they've met us before. We're not asking for something right when we first meet them. So, and they're just people, they, put their pants on one leg at a time like we do. And they're usually pretty busy. So, but it's good. I've had visits when Senator Boyd was a representative. I had several visits with him and his predecessor, Senator Galvano, and they were always good. I met some of their staff and still have connections with them. So I had some queries about, do students need to take the human trafficking class now before licensing or within a certain time frame of being licensed? Because I was having students take the class. And Kama Monroe's the director of the Board of Acupuncture, and she said no. It was a one-time requirement for licensed acupuncturists and had to be taken by January 1st, 2021. So if you're licensed after that, if you're a student now, there's no requirement to take this class. But you do have to have had it, and let me know if you need to take the class. We've got it available. So, David, I'll let you update this.
Yeah, last time we had a news update, we talked about two items on our agenda, and one of them was collaborating and doing some interdisciplinary projects with the radiology profession here in Florida. And part of that is really centered on education and making sure that the radiology profession is familiar with our privileges under our scope of practice for using imaging studies and tests to assist with diagnosis and treatment of patients' condition, and equally, or sometimes more importantly, proper referral of patients. For example, if somebody comes to you with persistent shoulder pain, you put them through an orthopedic range of motion study, and it feels like they're an appropriate candidate to select for acupuncture. You're treating them, and the patient's either not improving or getting worse. Certainly, they're appropriate for having an MRI study. If you find out that they have a full thickness tear, supraspinatus, or something that's going to give you a good answer as to why it is that they're having the problem they're having, and it enables you to make a proper diagnosis and referral so that the person can get to a higher echelon of care and hopefully get the treatment that they need. And all of that, it depends on our ability to be able to write orders and prescribe imaging studying for our patients. And of course, this has been included under our scope of practice since 2002, but it's not necessarily widely understood by other professions what our privileges are under our licensure and scope. So we're going to work closely with the Radiology Association. There's two separate association groups that we're reaching out to, and through our lobbyists and our attorneys to sort of start the ball rolling with the conversation with Allison Dudley, who is the lobbyist and general counsel for the Florida Radiological Association. There's also a separate Florida Radiology Business Management Association, which I think, one of these associations is more clinically oriented, and the other one is structured to assist professionals with their practice management. And I think collaborating with both of those makes sense for acupuncturists, and certainly FSOMA is going to take the opportunity to make these inroads and develop these relationships, and with the expectation that we can have a trickle-down effect through the associations and their members, who are the professional radiology practitioners, clinics, groups throughout the state of Florida, so that there's a better working understanding about what privileges acupuncturists have and how and why we use imaging to assist in patient selection as well as patient treatment. And so Corinne and Gabe have reached out. They'll be meeting again with Allison Dudley, and the radiology profession has its own large conference later in July. And I think this is a ripe conversation that Ms. Dudley is probably going to, include in some panel discussions to sort of begin the discussion about how do we develop tools to assist in some interdisciplinary training. I think it also lends itself to some biomed CEUs that are maybe a little bit more radiology specific to assist acupuncturists with better understanding, what are the indications for different forms of radiological study, whether it's X-ray, MRI, CAT scan, or even newer technologies. And it would be helpful if we had maybe some guidance from with that profession on standards for preparing orders and prescriptions, what information needs to be included in a standard order and request, and how do we communicate specific details about either why we're ordering the test, if we're trying to rule out a certain type of injury or pathology. All of those details can be helpful for the radiologist and the team when they're setting up a patient for an imaging study. And I think it's probably an area that acupuncturists would benefit from additional training on, only because a lot new developments are coming about all the time in radiology, and we want to make sure that we're current with whatever the standards of care are. So that's exciting. I'm looking forward to working with the Radiology Association and my counterparts there, and coming up with some strategies for bringing the two professions a little bit closer together and having a stronger working relationship. Thank you, Ellen.
All right, great. The only other thing, I noticed a little typo, but the Nevada bill is stalled and not expected to pass this year. That was
right. I'm sorry. Thank you. I didn't get to that. We talked about, there was some discussion in our last meeting about new legislation being pending or being introduced in Nevada that was designed to dissolve the Board of Acupuncture in that state and bring acupuncture under some advisory board, probably under the Board of Medicine. And as Ellen just said, it stalled, as legislation tends to. Not everything introduced is going to make it through committee, but certainly we're going to have to follow that that situation in Nevada for next year, and hopefully we don't see the bill reintroduced.
all right. And that is it for this evening.
Nice.
Let me stop the share. I'm going to go to the FSOMA website and just show the Love Your Practice. And because I really think it's worth taking a look at those teachers. I've opened up from the website the Love Your Practice page. You can go to FSOMA.org and click on the image there, and you'll get to this page, which is where you sign up. But we've got legislative updates. Why should you accept insurance with Sarit Hirschhorn? Why email marketing is powerful for your healthcare practice with Carl Schwartz from ELASA. Instagram 101, compounding and labeling rules for herbs. Are you and your business being seen? Paid search and business profiles to get seen from a marketing, SEO marketing company. HIPAA update essentials for data privacy, and approved clinical outcomes, boost your bottom line. These are all fairly short sessions, and then it'll have more about the speaker and the class, so you can go down if you're interested to find out more. But some great classes, a great overview. Sometimes it's like so much information and you've got to go home and digest it, but there's some good stuff there. So I hope people will enjoy it. And again, it's July 10th, so another July.
Is that a Florida event, or is it outside of Florida too?
That's Florida. I don't believe we're marketing it anywhere else. So, yeah. So, all right. I don't see any questions. Let me just take a look and see who we've got here. We've got just everybody put in the chat where you're from. We've got Adelaide.
Nice.
D'Ambrosia Hicks. Dickie Walls is here. Hey, Dickie.
Hey,
Leonard
Dickie.
Hicks. Michelle Bellinger. Renee Scubin. Hi, Renee. I need to talk to you about AMC. Rosalind Hamilton. Welcome, Rosalind. Sarah Allen and Will M. I'm not sure who Will M is, but welcome to all of you. So thank you.
Yeah, we appreciate everybody's participation. Thanks for joining tonight. And sometimes, we have more detail in a longer meeting. And tonight, we try to keep it pithy.
Oh, we got somebody from California.
Nice.
Redondo Beach. All right.
I know Florida homes are hard to come by. Everybody wants to move to Florida.
Yeah, it's the market is crazy right
Crazy
now.
right now.
Yeah. So, all right.
Thanks, Ellen.
Well, yep. Thank you. And thank you all for attending.
Everybody, thanks so much.
Yeah.
If there's no questions, we'll look forward to seeing you at our next update. And, share with your friends, if you don't mind, on social media. Remind them that the conference is in August. Our room block is filling up. And fortunately, we had a lot of the exhibitors rolled over their participation. So the conference is going to be well attended. And it'll have a lot of the usual sights and sounds with exhibitors and classes and opportunities for getting together and socializing. And it's a beautiful property at Fort Lauderdale Westin Resort, Fort Lauderdale Beach. But take a second and look at the registration page and any details there. If you have any questions, let Ellen know or feel free to email me. But share it on social media. Let your friends know what you're doing. We'd like to get as many people together because it just seems like it's much more fun to have all our friends in one place, at least one time a year.
Yep. All right. Thanks, you
guys.
all. All right. We'll see you all next time.
Good night, Ellen.
Good night.
Thanks so much, everybody.